with Dr. Barrett today, and you are a integrative vet, correct, in Hawaii?
Yep, that's correct.
Awesome. Dr. Barrett, I just wanted to talk a little bit about nutrition, how it affects health, all that kind of stuff, commonly overlooked things, and also maybe even how when we're working with pets that have health conditions, they're often kind of given these prescription diets, generalized prescription diets, and a lot of people think that that's their only option. And I just like to broaden everybody's horizons a little bit and bring their attention back to whole foods too. Obviously, it might be the right choice for some people based on budget and things like that, time constraints, but it's not your only option. So if we could talk a little bit about that and your thoughts and the things that you see in your practice.
Definitely. I think that's a really awesome topic for us to discuss because, like you said, it is often presented as the only option. And I think it's just the fact is a lot of vets aren't trained in more natural nutrition type of methods. And so the way that you tend to get trained in veterinary school is that there are prescription diets available for certain conditions, for example, kidney disease or lower urinary tract disease and things like that. So I think that unfortunately the nutrition training is lacking, and it's like you could only learn so much in 4 years of vet school. I feel like most vets are coming straight out. We're at that point where we still have a lot to learn just in practice. And so nutrition is kind of an interesting one of those because I think some schools are starting to teach more of natural nutrition for vets, but because there is this whole industry of pet foods, vets are taught to rely on that pretty heavily. And so that's just kind of where things stand these days. And so pet owners who are more inclined for having a natural approach are, I think, becoming more aware that they can ask for other options. It is sometimes like they have to discover it online or through friends and realizing that is an option. And so, I know that through your work as a nutritionist, you're trying to help people be aware and have access to those other types of options, and for myself as well.
One thing that I noticed too with nutrition clients, and this is something where I try to help bridge the gap that I'm seeing too, is that I will have people that, like you said, find on the internet that there's other options or something, and they'll reach out and they're very nervous to approach the conversation with their conventional vet. And I've even had a couple of people tell me they weren't going to tell them, which I always respond with, don't do that. Don't lie to your vet. Your vet can't help you either if they don't have all the information. And a lot of the times too, I do think that they're not being given the opportunity either to have these discussions with people because people are just like, oh, I'm too nervous to talk about it with them. So one of the things that I do is when I am making recipes for people, they get a complete nutritional analysis breakdown and everything, and they can give that to their vet. And I am happy to speak to their vet too if the vet has any questions. But could you maybe explain a little bit about why it's important to not hide those things from your vet too?
I totally agree with you on that. And, if you're someone who likes to do things more naturally and you feel that your vet doesn't align with that or support that, you may consider switching vets because there are more and more vets who are open-minded to those types of things. And, just like with your own health and your own doctors, in order to give you the best advice, they do need to know the full medical scenario going on. So if I agree that it is important to be transparent with your vet. If you feel that what is in alignment for you and your dog isn't going to be supported by them, or, you bring up the courage to talk to them and they kind of shoot it down, or, they're like, I don't agree with what you're doing, then I think that most vets would respect that you would maybe look for a second opinion or have an additional vet on your team who is more holistic, so that you can have that comprehensive approach. It's not like you have to ditch your old vet, but maybe finding a holistic vet on the AHVMA website is a good resource to try to look.
One of my questions too. Perfect.
American Holistic Veterinary Medical Association, and I think it's ahvma.org. and there's find a vet on there. So yeah, and myself, I have consults that I can do within reason of what's available for interstate practice laws and whatnot.
So let's say that somebody goes to their conventional vet, they've gotten lab work or things done, and they want to reach out to a holistic vet. I have heard from a lot of people that they've had difficulty finding holistic vets in specific areas and things. So would they be able to schedule a call with you, telehealth call or something with you with that lab work from their other vet, just to get your opinion on things or maybe a different approach?
Yeah, definitely. So when you have your primary veterinarian and they make the diagnosis, they do the diagnostics, it is okay to call on another vet or a nutritionist, someone like yourself, for advice pertaining to those records. There are some issues with laws, because if you're talking to a vet who's not licensed in the state that you live in, or hasn't seen you in person and have that what's called a client-patient relationship. That's a legal thing that is in place for a vet to actually make a diagnosis, give you a specific treatment recommendations. There are some limitations legally with that. So, if you talk to a holistic vet, just be understanding, be able to give general advice about topics. Absolutely. We can't necessarily prescribe specific things because it could be compromising a law.
Gotcha. That's super helpful. Thank you. So you have a wide variety of, on top of being a vet, certificates, and you specialize in like acupuncture and everything too. Could you talk a little bit about acupuncture? I personally have a very basic understanding of it, but I'm always so amazed by all these awesome stories I hear of pets and even people that are dealing with a wide variety of different health conditions where this has just been like the missing link for them.
Yeah, definitely. I think so. Acupuncture is, I think most people know what it is. It's using small sterile needles to stimulate different points on the body. And it's based on Chinese medicine, which has been using that practice for thousands of years. But there is kind of like a westernized approach to it now, that there's more of an understanding of the scientific neuroanatomy approach for why these points are effective. And it basically comes down to the points tend to be running along what's called neurovascular bundles. So where there are large concentrations of nerves or blood vessels, those things tend to run together anyway in the body. And so when you're stimulating those points, you could kind of think of it as like flipping the circuit breaker in the body. So especially like the points that go along the spine are very powerful points. And each level of the vertebrae as you go down correlates with a different internal organ. And it usually does have like a anatomic basis. So the ones up above the chest area are like for the heart and lungs. And then as you get further lower down into the abdomen, then, you have your kidney points and your intestine points and the bladder. And so, they do basically go in order of where the organs are actually placed, which is really cool. And so as you needle these points, they modulate the nervous system and those inputs and outputs from those nerves that are coming out from the spinal cord and branching out to innervate those organs. Acupuncture is known for how helpful it is in, like, for example, dogs that have hind leg paralysis, and they're like, oh, they got walking again with acupuncture. But I think other applications that are less known than, like, for orthopedic issues like arthritis, mobility, and nerve problems, because those are pretty well known. Yeah. You can use acupuncture for a lot of internal medicine issues too. So it can be a supportive modality for kidney disease, for heart disease, gastrointestinal things, digestion, movement, like for constipated prone animals. It can also help with nausea. So if a pet is undergoing some type of, cancer or digestive issues, there are points that can help to balance that. And then it also can be helpful for conditions that involve the immune system. So for example, like inflammatory or allergic conditions, there are points that can help to modulate the immune system. And so it can actually be a helpful adjunct for even like allergies and things like that.
That's awesome. Okay. And then because of you were just on that topic, I have one more question to piggyback off of that. I often get asked quite a bit on the nutrition side of things when pets are coming to me with allergies or food sensitivities and we're doing some type of elimination diet, and people are often asking me if it is worth it for them to go get the allergy test done at the vet office. What I found is that some of the panels aren't always super accurate. What are your opinion on the food sensitivity tests as well that use their saliva? Because I've had a lot of success with those recently, and it's a huge time saver, to be honest.
That's a great thing for us to discuss. So I have used the saliva test and had some pretty positive results with that as well. Okay. The other lab that I tend to use is called VDI, and they do a serum test for allergies. Okay. A lot of the other blood tests that I've seen results for didn't seem to have like consistent, repeatable results. Okay. And I heard that, when it comes to any allergy testing, you have to take it with a grain of salt, as I'm sure you know. It's basically like a suggestion for a direction to start in, because sometimes we're like, well, what are we gonna cut out to start your elimination diet? Maybe the results of that test could give us a starting point so that we could at least go off of like eliminating the ones that seem to flag of the most severe reactions. But yeah, a lot of the tests, they say if you send the same blood sample to 5 different labs, you're going to get 5 different sets of results. So I think knowing that allergy tests are not the most specific tests that we can get, and the results can vary quite a bit. Okay. But it is worth doing it to have some information, but I'm not going to live and die by those results for that pet. We do have to, at some point, do make those leaps of faith moving forward with like reintroducing foods and seeing how it goes, and obviously treating the patient, not just the results. Right. Those numbers that you get is really important. But I think that, as long as it's a relatively affordable test that's not going to use up all the pet owners' resources, it would be worth getting it, as long as, we understand that there are some limitations to that. Few ideas and may not have realized we're contributing. So I think that they are definitely a helpful tool.
Okay, great. So which health conditions can benefit from whole foods? I personally feel like it's a good bit of them, but I'd like to list off some examples here too, just for anybody that might be struggling at home.
Yeah, I would agree that I think pretty much any health condition can benefit from a whole foods diet. The whole way that we view it in terms of like the alphabet soup of the prescription diets, like this is a kidney diet and this is the liver diet and this is the urinary diet. And it's like, in the reality, like food is just food. And what we're doing by altering recipes and these level of nutrients is, there may be certain nutrients that can change the metabolism or the balance of things in the body if we alter them slightly. Yeah. So, for example, if a pet is in end stage kidney failure, you may want to have them on a diet that has a lower protein, lower phosphorus, some of those things that you hear a lot about kidney disease. And so it's not that it needs to be an exact certain way, but there are some parameters that, based on the current research that we have, we have our theories of this type of nutritional profile may be beneficial for treating that condition. But I think that we also have to remember, that our bodies are not machines. We're not like a car engine. And so it's not like, when your kidneys are broken, you just replace that and treat that and everything else is fine. Because everything in your body has a connection, in so many ways. Using like a therapeutic diet, it's not like we can, even if we were trying to target one particular organ, we can't. It's like if you change one thing about the diet, then it's going to have effects in other ways. Food therapy in Chinese medicine, the foods have thermal properties and other properties of the ways that they will influence the body. Any type of health condition, whether it's kidney problems, urinary problems, cancer, heart disease, blood pressure issues, eye problems. There's pretty much therapeutic diets for everything. From a Western perspective, they have the alphabet soup. Like if you look at the science diet, prescription diet list, they have quite a lot of conditions that they claim to be able to treat with their prescription diets. When you look at Chinese medicine, food therapy, because that was their only modality for, Chinese medicine was how they treated everything in that culture for thousands of years. And so there's pretty much a food therapy approach to any health condition that exists using those approaches. So even if we don't have like a Western science ideal diet for a certain condition, you also may want to look up what is the Chinese medical food therapy recommendations for the condition that your pet has, because that may also give you ideas.
Customizable like feeding approach. Like you have so much that you can do and tweak for the dog, and there's just endless possibilities.
So many possibilities, and it's a matter of pushing ourselves to think outside of the box too. Yeah. And not just accepting one set of recommendations as the facts. If it doesn't resonate and you're like, well, my vet said my dog has this disease and I have to feed this and I feel really limited and scared by that, just take some time to maybe get a second opinion, read some blogs from holistic vets. There's a lot of Facebook groups and stuff for different conditions that you can also get ideas from other pet parents, or talk to a nutritionist such as yourself, and just take the time to learn more about it, because as you do, you'll find a lot of things that you probably never would have even imagined.
I also want to say too that I think that there's a lot of limitations when it does come to those generalized like the prescription diets in general, because again, you're not able to customize that for each individual dog. And I personally see the limitations of it quite a bit with, I have a very large, I got recommended in a breed group for HUA Dalmatians at one point, and like 40% of my client list is Dalmatians now. And I see a lot of limitations with the urinary diets for them specifically, because they need, lower purines in their diet, etc. And they will go on these diets and they'll see a little bit of a positive result for the first month is what I've seen off of their lab work and everything. And then it just kind of seems to plateau out, or they're recommended to go on a vegetarian diet. Those urinary diets are very generalized for like multiple conditions and not specifically for dogs with high uric acid. And we've done dissolution diets now. So if they have crystals present from, they do a ultrasound, there are crystals present, we'll do a dissolution diet. And usually within like a month and a half to 2 months, we can, if not completely get rid of those crystals, they're almost 90% gone within that time frame. And then we go to a maintenance diet from there. Whereas before they were on these generalized UD diets and they were going 5-6 months with a little bit of a better urinary pH for an HUA dog, but there's still crystals present. They still have like inflamed skin from the ingredients and inflammation and all that kind of stuff. So I do think that they have their limitations too. So if you're on one of these diets and it's not working for your pet, there are other options out there for you, I guess.
Agree with you on that. And the other thing that we see quite a bit is if you're given that prescription diet as your best option, then the dog won't eat it.
Yeah.
And that's a lot of the times that I get referrals for dogs with any kind of disease that's been put on a prescription diet. And then they say, well, the dog hates it, they won't eat it, so now what do I do? And I think sometimes that can be a silver lining to the problem of like, they don't like that food. And then it can actually get to the point where that pet owner is finally able to home cook or find a good, more fresh whole food recipe for that dog. And so, in the end, even though they maybe have an illness that we're treating, they're probably on a better quality, more fresh, human grade, natural diet than they were previously. So
yes,
if that's what it takes to get them that point, then I think, they may end up on a better diet for their therapeutic diet than they may have been on for their whole life if they were just on a kind of a typical commercial kibble food.
Any final words you'd like to leave everybody with? Where can everyone find you at? All of that good stuff.
Yeah, I think this final words of wisdom, feel empowered as a pet owner. You're the advocate for your pet. So if you're receiving advice that doesn't feel right to you, feel empowered to branch out and get second opinions, consult with people who maybe seem to be more in alignment with your own beliefs, health, and the approach to health, because you may or may not be aware of the big divide that exists right now between the kind of conventional space and the holistic space. And I think that there's definitely a need and a use for both sides of it.
Yes.
So you're going to be the most, have the most tools for your dog or cat if you are utilizing both conventional and holistic type of approaches to health. So it is good to try to get some people on your team who can support you in that balance and help you to use the best of both, so that you're able to give your dog and give your pets a really good life.
Perfect. And where can we find you at? I know you're on Instagram.
So it might be easiest to try to find me through my website. It's drbarrettvet.com. It's drbarrettvet.com. And through that, that's the same basically Instagram handle, but all the social media stuff is linked on my website.
Okay.
And I also have my practice is called Muse Holistic Veterinary Care. And so there's links on my website to that. I have an Instagram that's separate for that. Right now I'm developing an online course for pet owners to just learn about foundations of holistic approach. And then also there's an advanced module to the course that is more of like getting into the acupuncture and sound therapy and aromatherapy, and it's kind of like the more fun woo-woo stuff that I love. But the foundation course is really good because you go over nutrition and physical health, fitness, behavior, stuff like that. So I will be launching that in the next couple of months.
Great. So I'll link all of that in the description box for everybody so that they can find you. Thank you so much for making the time and joining me today, and really appreciate it.
Thanks for having me.